Yes, hello, my good people. How are you doing today? Yes, Dominic here, and welcome to my health talk show today as we keep on educating each other. As well, today is 1st of December 2023, the last month of the year, and today basically it's World HIV/AIDS Day. So this is a day that is commemorated all over the world. And as a healthcare personnel today, I want to take part in this day by telling you something. I know it's obvious that almost all of us, if not all of us, we all know about HIV/AIDS, and it's something that it has been talked for years and years. But I believe every day there is something new that you can always learn. So today, before I talk about what I want to say, I believe you all know about what is the definition of HIV and what is the definition of AIDS. So HIV basically that is human immune deficiency virus, HIV, and AIDS is an acquired immune deficiency syndrome. So you normally get HIV before you get AIDS. You may get HIV and you may not be able to get into AIDS category, but sometimes you may have both. So a syndrome is a collection of symptoms, right? Yes. Now to the topic of the day. Today I want to talk about what we call opportunistic infections in HIV/AIDS. When we talk about opportunistic infections here, we are talking about those conditions that come about as a result of immune compromised body system. HIV is a condition that compromises the immunity, and as such, some other conditions, some other infections take an opportunistic, rather become much more opportunistic, and they get into your body because the body is already weakened in terms of immunity. So there are very many types of opportunistic infection that we can talk of, and but I may not talk about all of them, but I'm going just to mention some few opportunistic infections. Number one is what we call TB or tuberculosis. TB, we have different types of TB. The one which most of us know, it's pulmonary TB, that is rather PTB, yeah? But also we do have TB which is outside the pulmonary system. We call it extrapulmonary TB. So TB is one of the main opportunistic infections with people living with HIV. Another opportunistic infection, that is number two, is what we call pneumonia. Pneumonia is the very common also opportunistic infection. Mostly we do have the type of pneumocystic carinae, that is which is common in HIV. Number three is candidiasis, or fungal infection. So candidiasis here, we mean those people you may have oral candidiasis, or what we call oropharyngeal candidiasis. Sometimes could be urogenital candidiasis. Those are some of the opportunistic infection. Number four is skin fungal infections. Different skin fungal infections, the likes of psoriasis and the rest, can also be an opportunistic infection. Number five, it's herpes simplex. It's a viral infection. Number six is what we call human papillomavirus, or HPV, is one of the main virus that is responsible even with cervical cancer, that is in women. So another rather opportunistic infection, that is number six, I guess, or rather number seven. Yes, meningitis. Meningitis is one of the opportunistic infection, especially what we call cryptococcal meningitis. So if you see sometimes patients of who have HIV and they present with a very severe headache, and later on they are diagnosed with the meningitis, most of the time they have what we call cryptococcal meningitis, which is basically one of the opportunistic infection. Number 8, there is a condition we call Kaposis sarcoma, KS, right? Is a skin cancer kind of, which is basically affects especially people living with HIV/AIDS. Another one is what we call toxoplasmosis, is another opportunistic infection. That is number 9. Number 10 is encephalitis. Is one of the conditions that affect actually the brain. Sometimes once that one reaches the brain, sometimes some people may literally run mad. Yeah, that is HIV encephalitis. There is another viral condition called varicella zoster. It's another opportunistic infection. Number 12 is what we call staphylococcus and streptococcus kind of infection. Those are some of the bacterial infections that are very common in HIV. Another one is Epstein-Barr virus. It's one of the opportunistic infection. That is number 13. Number 14 is sometimes intestinal infections, the likes of salmonellosis is one of the conditions. And then lastly, there is what we call lymphomas. Those are the main opportunistic infections, although there are very many of them, but I've just mentioned a few of them. So up to this end, that is what we call opportunistic infections in HIV. So basically there are a lot of them, as I've said. I may not have mentioned all of them, but that's basically what I wanted to tell you. So up to this end, yes, HIV/AIDS Day, I'll ask a question. What step have you taken today in this fight against HIV/AIDS Day? Right? So the theme of the year, I believe it's all over social media and everywhere. Yes, so let's all together work in fight of this condition. Know your health and stay safe. As I always say, health is wealth. Thank you, and may God bless you. But before I finish up, keep on subscribing to my YouTube channel. Keep on following me on my social media platforms, that is Facebook and TikTok. Thank you, and may God bless you.